Hi, you guys. Welcome back for our daily practice questions. It is day 40. And as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, digital flashcards, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos that you may see that I am teaching on things that we currently do in practice, I will always say that so there's no confusion. So, that being said, let's get into our questions for today. Real quick before I get started, y'all know it's Super Bowl Sunday, and some of you may have seen if you're on my email list that you have received the Super Bowl Sunday sale. So, or if you follow any of my social media, you'll see it, or go check out the community post and see if it's something that you want to take advantage of. It is for my 4-week custom one-on-one plan. I have two availabilities, and it is 25% off, or if you are trying to get the digital flashcards, they are on sale for 39. So just go check it out if that's something you want to take advantage of, because we have 10 available for the flashcards, and I have two availability for one-on-one 4-week reviewers. Okay. But let's get into question number one for today. Question number one states a 52-year-old female presents with a triglyceride level of 600 milligrams per deciliter. She has a history of hyperlipidemia and is not on any current medication. Which of the following is the first line therapy for lowering triglycerides in this patient, according to current guidelines? Is it A, statins, B, fibrates, C, niacin, or D, omega 3 fatty acids? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first. Stem of the question here states, which of the following is the first line therapy for lowering triglycerides in this patient according to current guidelines? All right, so anytime we talk about treatment, y'all know I tell y'all to run it back and look and see if there has been a diagnosis provided. In the event that the diagnosis has not been provided, I tell you to run it back a step further and look at those assessment findings so that you're able to determine a diagnosis, because you got to know what it is to be able to treat it, right? So it speaks of hyperlipidemia management and lowering triglycerides. So that stem does tell us that we are focused on this hypertriglyceridemia and the first line therapy for it. So the triglyceride level is 600 milligrams per deciliter. We talked about this yesterday, and we talked about it some at the beginning of the week. Remembering, we know that when we are focused on this, the LDLs and lowering that lipid panel, we start with our statins. But in the event that our triglycerides are greater than 500, they become the priority, and we focus on that treatment, right? So we remember talking about this. Fibrates are that first line therapy. We can utilize fibrates or niacin, but fibrates is the top of the top, because it helps to lower the triglycerides. It pinpoints that specifically, but it also helps to aid in cardiovascular risk factors to reduce that as well. Whereas niacin does help to lower those triglycerides as well, they also have those side effects, especially that flushing that is commonly associated with it, that makes that one of those not so favorable choices, and people typically do not comply as well as they do to fibrates. All right, question number two. A 68-year-old male who is newly diagnosed with hypertension, blood pressure being 150/92, presents to your clinic. He is otherwise healthy and not currently on any antihypertensive medications. According to the ACC and AHA guidelines, what is the recommended first line treatment for this patient? Is it A, an ACE inhibitor, B, a calcium channel blocker, C, thiazide diuretics, or D, beta blockers? Take a moment and tell me what you got in the comments, y'all. All right, stem of the question here states, according to the ACC and AHA guidelines, what is the recommended first line treatment for this patient? All right, so we're talking hypertension management, right? So how do we want to go with this patient? So let's walk it down, right? So we have a 68-year-old male, newly diagnosed with hypertension. Otherwise, it's healthy, so no other comorbidities. Doesn't specify any allergies or any other issues that may warrant us not to utilize certain medications. So y'all know when we go for our first line, thiazides is the captain, right? So there's nothing that tells us that he can't have the thiazides. So we're going with C, thiazide diuretics, right? There's nothing that says there's renal protection needed, so we don't have to go with the ACE or a ARB. So again, thiazides are best. So C is your best answer. And lastly, question number 3. A 55-year-old female presents with a history of exertional dyspnea, fatigue, and a history of rheumatic fever as a child. On exam, you hear a diastolic rumbling murmur, best heard at the apex of the heart. What is the most likely diagnosis? Is it A, mitral stenosis, B, aortic regurgitation, C, mitral regurgitation, or D, aortic stenosis? Tell me what you got in the comments, y'all. All right, so stemming the question here, on exam, you hear a diastolic rumbling murmur, best heard at the apex. What is the most likely diagnosis? So we're talking murmur, right? And so I tell y'all with the murmurs, what are my two things that I say? For question purposes, make sure you're able to identify systolic versus diastolic, right? That's number one. And it tells you it is diastolic. So let's think of our diastolic murmurs. Remember, Brittany's brilliant is sassy systolic is men really are silly. So that's your mitral regurg and your aortic stenosis. And then I say diastolic is the opposite, right? So then we have mitral stenosis and aortic regurgitation, right? So we know that these diastolic murmurs, it will have to be either A or B for this answer choice, right? Now, number 2, I tell y'all to determine what location. Where is the location that they're telling you? And it says it's best heard at the apex. So is aortic or mitral at the apex of the heart? It's mitral, right? Remember MA, mitral at the apex. So it has to be A, mitral stenosis, because mitral stenosis is the type of mitral diastolic murmur, right? So A is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here as we continue to cover our cardiac series. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. Also, like I said, if you're looking to take advantage of these things, there are 2 of those things listed in the bio of this channel that are currently on sale. So I would go that route before if those are things that you are looking to utilize. If you're looking to book any of my one-on-one sessions, I always say either call, text, or email so that I can speak with you first to gauge what you truly need to make sure you're booking the appropriate session type. But as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.